Hello, everybody. I'd like to welcome you all to the US Reps October webinar, Understanding Professional Boundaries of the Exercise Profession. One of the most common terms that's used by exercise professionals is scope of practice. They don't really understand its meaning. Today, we're going to explore this concept and the scope of competency and highlight some legal and ethical boundaries within the profession. We're going to explore some practical strategies to navigate situations and related to professional limits. And we're going to have a better understanding of this role and highlight some uh, your professional bounds. My name is Francis Nerk, and I will be hosting today's webinar. I'm joined with our esteemed panelists, Dr. Chad Buckendahl, Dr. Susan Davis-Becker, and Mr. Thomas Troutman. A bit of housekeeping. Make sure you ask your questions in the chat. We'll answer those in the last 15 minutes of today's webinar. And this webinar will be recorded and sent out to you all of those who have registered for it. And it's also going to be free on our YouTube as well. So I will kick us off with our first question for this panel. To get us started, could you provide our audience with why certifications and licenses exist? And maybe Chad, you can get us started.
Sure, thanks, Francis. So, the origins around licensure in particular is related to public protection, and certification kind of evolved out of that as a voluntary pathway where for purposes of kind of distinguishing oneself within a profession, there's a whole interesting history that we don't have time to get into today, but this all falls under the broad category of credentialing, of which there is licensure, certification, registration, assessment-based certificates, stackable credentials, a whole bunch of different sort of recognition designations. But ultimately, the kind of key differentiator is it mandatory or is it voluntary? And traditionally, certifications have been voluntary, licensure mandatory to practice.
And I guess for the panel, how are certifications? And I guess let's go to certifications and licenses. It's probably the one that folks use or most used to the most. How are those similar and how are they different?
Sure, I'll start there. So again, licensure being a regulated by some type of government entity, again, at the state level, that means that the state typically has something like a scope of practice for that profession for a particular role. So that means they're maybe putting limits or bounds on what the individuals in that area can do. Whereas certification, again, it's a form of self-regulation within an industry. And so that's saying that the industry has come together to set standards and determine eligibility and credibility for a role. So again, it's kind of self versus external.
Awesome. And I apologize. I was so excited to get the session started and I totally forgot to do introductions. And so I'm going to back up the train just for a second, just so everybody has understanding like who's providing the insights. Chad, could you start us first?
Sure. My name's Chad Buckendahl. I am a psychometrician at ACS Ventures. Work with credentialing programs as well as some programs in education. I previously served as a psychometric commissioner on the National Commission for Certifying Agencies, and happen to also serve as an advisory member to the Council on Registered Exercise Professionals.
Well, Thomas.
Hi, everyone. I'm Thomas Troutman. I'm a psychometrician at PSI in their certifications department. I've been doing that for 3 years and have 2 additional years in certification test development. I work with CSCCA's Strength and Conditioning Certified Program and NESTA's Personal Fitness Trainer Program, doing job analysis, exam development, standard setting. So I'm happy to talk about exercise professionals with you all today.
And Susan.
Sure. Hi, everyone. Francis, we love your excitement for getting into the content.
Sorry.
No, it's great. I'm Susan Davis-Becker. I'm also a psychometrician and partner at ACS Ventures. I've been in the field consulting with different types of credentialing programs as well as educational programs now for almost 20 years. And I have the honor to work with a couple of groups in this space, such as the NSCA and ACSM. So, hi, everyone.
Wonderful. So kind of going back to kind of the licensure and kind of certification space, and I guess it's like can certifications also be licenses? I think Chad, I think we had a discussion about that. You're talking about CPAs. Could you explain that? Can you explain that?
Yeah, some professions, the designation that somebody receives may actually be called a certified role of some sort, but they function as de facto licenses. So evolution for some of these programs, and Francis, you mentioned the CPAs, right? A certified public accountant is technically a licensed role. Similarly, occupational therapists are certified, but one cannot claim to be an occupational therapist without that certification. So in a way, it becomes protected, and physician assistants are similar. There are a number of professions that, as the profession has moved from self-regulation to governmental regulation, they don't necessarily like change the particular title, but in terms of some of the sort of, I don't know, responsibility or ability to control that credential starts to shift from the profession then to, as Susan was kind of mentioned, a state, or in most cases, a legislative body. There's a couple kind of federal ones as well, but those legislatures at the state level tend to then have more influence over your practice act at that point.
So I guess the next questions, and I think within the fitness industry, we talk about accredited certifications, and accredited being either the NCCA accreditation, which is probably the most of the ones within the fitness industry in the United States like that, or the ISO IEC 17024, could be any mouthful, accreditation internationally. And part of that, there are things called like a job task analysis. Can you describe that? And then the difference between, I guess, what's a job task analysis versus kind of scope of practice, and kind of, would you be able to kind of explore that a little bit? And I think Susan, maybe you can start us off on that one.
Sure. So I'll talk a little bit about the differences, and then I think maybe Thomas could share more about like what goes into the job task analysis.
Yeah.
So a scope of practice is a little bit different, although these two could be easily related. Within a scope of practice, you do have you're talking typically about the bounds of what's the types of services someone can provide, and then often what they cannot provide, or maybe the bounds on it of where it does move to another profession or another regulated profession, perhaps. And so within a scope of practice, it might say the types of services you can do, who you can work with, and what rules or regulations that you're bound by. And so it can be very, I'll say, strict in that sense, but laying out those guidelines to, again, protect the public and ensure only those professionals who are properly trained are engaging in those types of services.
I guess what's the difference between that and a job task analysis? Because certifications are underpinned by a job task analysis, or sometimes called a role delineation study. Can you kind of describe the difference between those?
Sure. So a job task analysis or role delineation study might get into more of, the specifics of how someone engages in those services, the depth and breadth of their knowledge and skills with respect to those services, what those job tasks might look like in those services. Typically does not include specific boundaries or bounds on what they can do, other than just by maybe not listing them in there. So it's not meant to be an exhaustive list, but the scope of practice, again, is more on defining what's in the box and then what's not inside the box. So Thomas, do you want to talk more about the job task analysis piece?
Yeah. So a job task analysis, it can also be called a practice analysis, job analysis. Sometimes it's also called a role delineation study. So ultimately, with a job task analysis, you're looking to develop a list of tasks and knowledge statements that define the minimally competent practitioner for a particular certification or license. So usually this involves a panel of subject matter experts. Often there's a survey sent out to the practitioner population to get their intake on it. And a lot of times, the job task analysis is the cornerstone of the certification or license. It serves as the basis for the examination content outline, which is where your certification or licensure exam comes from. I think it is important to note that while a job task analysis and a scope of practice are related, I don't think that a scope of practice should be used as a replacement or an alternative to a job task analysis. We talked about NCCA accreditation earlier. NCCA is quite specific about doing your job task analysis generally once every 5 years. So a scope of practice would be more of an addition or a supplement to your job task analysis, because you really do need to be able to define what that minimally competent practitioner does at the task and knowledge level.
Mhm.
And I guess for the three of you, I guess I'm wanted to know is, are there any certification bodies, not just in the fitness sector, but any of this kind of the bodies that offer certifications, NCCA or ISO accredited? Are you familiar with any organizations that do have a scope of practice for as the kind of to complement their job task analysis? I don't know if any of you are familiar with that.
Well, I mean, I mentioned a couple of those professions that are in the certification space, and their scope of practice has, I guess, somewhat indirectly, I mean, with their input, but their scope of practice has kind of been defined for them. So when some of those certifying bodies kind of transition from certification to then licensing, um, the professional board that may oversee and help to define those sorts of tasks, knowledge, skills, when that starts to then shift to, like I said, like a legislative committee or a governing board that is outside of the profession, that scope of practice, they're now all of a sudden become additional stakeholders that may have input or desire to influence what that scope of practice is, and in particular, how it may either intersect or conflict with other scopes of practice that have already been defined legislatively as then being kind of protected for certain professions or roles. So I'm actually not aware of any kind of self-regulating certifying body. And that's where I mentioned that sort of like little nuance of some certifications are really licenses. And those are the ones that tend to have a scope of practice, but it may or may not have been of their own choosing.
Yeah, I'm in the same boat here where I can't point to one that as a specific example. I have heard though, like in the middle of like a job task analysis process, as Thomas was describing, I've heard groups reference like, oh, they work within the scope of practice for our profession. And then you push a little bit on, you're like, well, where's that documented? Who do we cite for this? And they're like, well, it's not really written down anywhere. So it's this understood scope of practice that programs feel those who are leading a profession say, we all understand what the boundaries are, but they're not formalized anywhere in a way that one could point to it, we can reference it, we can come to consensus on it. Or of course, then we can't really do much with it again, with it's just an understanding.
Yeah, I agree with Susan that this is not something that I've seen explicitly spelled in a document. You know, it is implicit in a way with what a lot of certification organizations do. They have their mission statements, they have their eligibility requirements are part of a scope of practice. They do define who can be part of the certification. As we mentioned, the job task analysis, it does have an implicit scope of practice, since the job task analysis shouldn't include anything that isn't part of the scope. But it usually is not, a separate document that is explicitly lays out what the scope and the boundaries of the certification are.
Well, Thomas, I think the last time we talked, I think one of the concepts you brought up is just like, at what point do you, as part of your as if I'm an exercise professional, at what point do I refer out to somebody else? Is kind of what are your thoughts on that?
I do think that scope of practice, it is a testable concept um, that you can include in your assessments. You can include a line in your job task analysis about, being multidisciplinary, knowing when to refer out. There are several situations that this commonly shows up for a lot of exercise professionals. Nutrition is one of them, kind of the boundaries between understanding general nutrition and referring out to a registered dietitian. This also happens with mental health, kind of recognizing an athlete's mental health situation and when to refer out to a professional. Sometimes also with medical situations, we often expect coaches and trainers to be able to handle emergency interventions, but there is a pretty fine distinction between an emergency intervention and doing a medical diagnosis. And we can expect candidates at the minimal competence level to be able to identify that. And you can write test questions where the correct answer is refer this out to someone else because this isn't within the scope of practice for this credential.
Yeah, I think that's a
So-
great point. I think where we see programs often talking about scope of practice, maybe without even talking about it, is when they're in that job task analysis and as Thomas described, where they're talking about referral. You hit the point of you need to refer or consult with, you need to bring in those outside professionals to supplement the knowledge, or you need to ask them to help with your maybe individual clients or athletes situation. And again, it's sharing them as a client there. So I think again, it's another example of where programs often talk in terms of scope of practice, maybe without specifically referencing one.
Thank you all for that. So considering scopes of practice are reserved for licensure and they don't exist for certification, do you all think there's value to create a scope of practice like document, like a complementary document for certified professionals? And if so, why would an organization do that?
So I'll take kind of a first stab. My colleagues can jump in here too, but I do think there's value in doing it for a couple reasons. I think the first reason is, as Thomas and Susan have mentioned, that scope of practice helps to establish kind of the limits of what are kind of acceptable for your particular role or profession under this certified framework to be able to do. And that has value because it gives you a chance then to, especially if you're in the voluntary certification space, to kind of compare and contrast yourself with other professions to say, okay, here's where we have some overlap. Here's where we are complementary versus supplementary to perhaps other professionals that we either seek to collaborate with or make, create these sort of professional patient-centered care sort of relationships. I think the secondary reason, honestly, is, and I am definitely not expert in this particular area, but I do think about it from a risk mitigation standpoint. And what is the scope of my general liability insurance going to cover? And I think when a profession is able to kind of say, here's the upper limits, and when professional associations then who do often try to help. I know like psychology, we can go through one of our professional associations in order to get general liability or errors and omissions policies. And there's kind of an expected scope beyond which, we can't travel. And I think for people in the exercise, the exercise space, to know what that sort of upper limit is, in order to then also know if I go beyond this, I'm putting myself, the profession, but I'm putting myself then at legal risk as well. And having some of those clear boundaries defined by the profession removes some of the discretionary choice where some people may feel more comfortable going outside those bounds than others. And it just, as a profession, creates a little bit more consistency.
Think
I don't
about
know.
this. Yeah, that totally makes sense. And the areas that I, off the top of my head, that I think of, Chad, when you're bringing this up, is one is in the athletic space, and I think about return to play. If somebody has like an ACL reconstruction or they have some sort of injury, they work with a physical therapist and or athletic trainer, and then as they're transitioning back to their sport, being able to understand what was your responsibility and where did you get them and where am I picking up, and then at what point do we transition back and forth between each other and a shared knowledge between the two. The other side is kind of in the medical fitness space. again, working with a physical therapist or a nurse or a physician, and when they see value in somebody's services, but they're just maybe unclear what exactly what they do and where they can blend between, I guess, the continuum of care of a patient and a client or athlete. That just in my mind, it just totally makes sense.
Mhm.
What are your thoughts, I guess, for the group is like things like OSHA and crane operators as an example, and occupational therapists and CPAs, and how they use these scope of practice documents to influence practice acts?
I'm happy to take first stab at that one too. So with so Francis, you mentioned the crane operator. So that is one of a couple sort of credentials that, again, there are certified crane operators that really function as licensing. And in those instances, licensing is largely done at the federal level, overseen by OSHA, Occupational Safety and Health Administration. And because of the potential risk to the public and the potential variability among different state jurisdictional requirements, because there are some in addition to the federal, there are some state specific requirements in a lot of jurisdictions around that as well. Those the profession usually what happens is there has to be something unfortunately bad that happens. So within a profession, if something bad happens and that profession is self-regulating, there is usually some sort of public outcry that then causes government intervention in order to then start to regulate the profession, because the perception is that the profession itself couldn't regulate itself. And so so the opportunity then to influence those practice acts, if you do find yourself or your profession in a situation where the government is getting interested in you, um, that there's a very, very old saying that says, just because you may not be interested in politics doesn't mean that politics may not be interested in you. That works well in the example, because if you find yourself in a situation where a government entity does want to step in and start to regulate or oversee what your profession is doing, being more proactive gives you a better opportunity to have a seat at the table to help define what that scope of practice then might look like, versus it kind of being wrested away from your profession and having to then lobby pretty hard for that sort of input. Because, as I mentioned, when at the legislative level in states, when practice acts get opened, and for example, like when the dental practice acts gets opened in a particular state, that's the opportunity for dental hygienists, dental assistants, general consumers that sell tooth whitening, lasers and stuff. There are all these opportunities to lobby and try to influence the legislature, who are not expert in these content areas, on what potentially goes into as acceptable or limits as to what that profession can do. And so, because you're kind of moving outside the profession, the opportunity to influence is there. But if you miss that opportunity, like, you literally can have like parts of your profession be eroded a little bit because of having ultimately sort of ceded some of that control to a I guess non-content area, or profession specific area of expertise in doing so.
Other thoughts, Susan and
Yeah,
Thomas?
I think it's extremely important to kind of think about what the opportunity is here for credentialing programs. Going back to your earlier question, should this be something that credentialing programs thinking about developing? I completely agree that they should. It's not really something we've explored before. So the conversations we've been having, even leading up to this webinar, have been really eye-opening to think about what the opportunity may be. We often think about, these credentials that are being developed by a variety of programs of, great, this is a great way for professionals to show what they know and can do, for employers to recognize these demonstrated knowledge and skills. This is great. But the direction Chad was just going was talking about there may be a day where the, politics, where state government, federal government comes in and says, we need to take over because you're not doing the job that you need to do to truly protect the public. There's been too many instances of. And so I think number one, setting ourselves up to ensure that we are doing it the best job we can, might include developing that scope of practice. And then two, if that day does come, that we have the opportunity to be more influential if we have these solid and trusted and consent documents where the industry has come together and said, we agree on this. Because it's a big deal once it becomes a license and once legislatures are involved. As Chad said, there can be differences across states. And then so groups that are trying to, say, create a credentialing exam have to look at each state, find the commonalities, discuss how do we handle the differences, what do we do with all that? So that's a more challenging situation. And then I think even this summer, there's a situation going on like through the AMA, the American Medical Association, where they're looking at, potential scope creep of some professions going into the world of medicine. How do they fight that? And so they're having to lobby some of these groups to try and reclaim their areas or set up those boundaries that they're not happy with. So again, by setting our own boundaries, I think we have a lot of opportunity here to be more influential in the state we're in. And then if we ever, if professions ever do get to that state of potential licensure.
Great. Thomas, any other thoughts?
Yeah, I will say that scope of practice, it should always be something in the back of your mind. Whenever you're writing or reviewing an examination items are not good or bad in a vacuum. They need to be appropriate for the credential. So it could be an item that has really good references, maybe it even has good statistics, but you should really think about, does this apply to the credential in question? And if not, then it probably shouldn't be on the exam. And having a specified scope of practice document could very well help with that. In terms of defending your credential from the government, I will say that ICE has a relatively new defensive credentialing toolkit that I helped work on, so I'll plug it a little bit. So if you are having any questions or you just want to look at some resources in that area, that can be very helpful as well.
Wonderful. So I'm going to put you all on the spot and really kind of think about, because scopes of practice don't exist, and so this is going to be a bit hypothetical, I suppose. I think the next question I have for you is, if you were going to design conceptually a kind of what a standardized scope of practice would be for a voluntary certification, what elements would you include? And then conversely, what would you avoid as a psychometric expert who's navigating the process?
I think one thing to, starting with I'll start with the what to avoid and then kind of say what I might include. I think what to avoid is I would make sure to avoid making it a job task analysis, like as Thomas pointed out. Let's avoid that. There's still space for that. There's still a need for that, but it's a unique space. And so we would want this to be able to potentially inform that activity, but not tie the hands of that activity. We know that this might be a more longstanding document compared to a job task analysis. So I think what might need to go in there is you'd need to talk about the role and what it is. What again, as mentioned earlier, like what types of services are involved and who are you providing these to? Is there an age or some kind of group limit of what you're qualified to do? I think you need to lay out the qualifications. How does someone get to the ability to do this, right? And this is often something we've done in, let's say, program design and credentialing, where we talk about what education do they need, what kind of experience do they need, what kind of credentials might indicate they're qualified for this. What professional regulations or standards are relevant? Each profession often has standards that we've maybe agreed on. Hopefully they're profession-wide. What standards should dictate how you practice, how you provide those services? Maybe they're industry standards, maybe they're ethical standards, professionalism standards, what exists? And maybe going through that, you could even identify like, what do we not have in our field? Do we have professionalism standards for our fields? Do we have ethical guidelines for fitness professionals? Maybe we should create those. And then, as I mentioned, what limitations, clear boundaries, right? We couldn't write every limit. We're not going to say this exercise professional shouldn't be a crane operator or is not qualified to operate a crane. But as we've talked about things like nutrition, our proximate mental health, medical, where do those bounds exist? What is clearly within the purview of a different regulated profession? And setting those out to recognize that these individuals, based on this scope, are not qualified to do that. They would have to seek another credential to do that.
Thomas.
Thomas, you want
Other
to go?
thoughts?
I mean, I think Susan's answer was really great. I think that the primary difference between a scope of practice and a job analysis would be kind of focusing on the negative. What don't you as an exercise professional do on a daily basis? What's that limitation, whether legal or just, what's not appropriate at kind of that minimum competence level? What's appropriate for other professionals in the field and not necessarily professionals in this credential? I think the scope of practice, I think that could be a really great opportunity to work across credentials, kind of defining what's appropriate here and not appropriate here. Because sometimes there will be overlap between credentials, but there also should be some areas in which there are kind of clear delineations in which this falls under our practice, but not yours.
So can I explore that just a little bit, Thomas, kind of what your thoughts are, and I'd love to hear your opinion on it and others. It's because I've seen folks, I know on certain projects that you do what's a Delphi method, where you bring in the relevant stakeholders, like I think maybe a physician or the exercise professional, a physical therapist, where they come to a consensus about where those things is. Would you include, excuse me, those type of professionals in that kind of scope of practice document, or would it only be the practicing professionals? Because I know with the JTA, it would be a full complement of mostly of those who are actively in the space, but it doesn't necessarily have the ones that are kind of outside of the space. Kind of, what are your thoughts on that?
Yeah, so for a GTA, generally you only include the professionals that are kind of directly associated with the credential. For a scope of practice, I do think that it could be more appropriate to bring in adjacent professionals, medical doctors, nutritionists, that kind of thing. Really to kind of define the exact level, of knowledge that would be appropriate to be within the scope of practice for that credential, and what is lies outside of it.
Yeah, and I would supplement that. I think having some of those stakeholders from the different professions is a good idea, particularly if they are knowledgeable about some of the detailed characteristics of the practice acts under which they're regulated. And like one of the things, this is actually something that's a lot easier to do now with some of the generative AI tools, and that is do a comparison and contrast with some of the practice acts for these, peer or adjunct sorts of professions that you do have sorts of interactions with, or you worry that you might be kind of bumping up against in terms of overlap, and look to see what some of those limits are, including like simple things. We talked when we were kind of prepping for this, like that distinction between diagnosis and assessment, where certain professions, the regulatory language actually specifies whether or not you are allowed to, quote, diagnose something. And Thomas mentioned like mental health, for example, earlier for exercise professionals. And that is something where I'm quite sure they are not allowed to diagnose, because it is outside, not within the regulated scope of practice. And so I think being able to, as part of building a scope of practice, look definitely kind of inward at the profession itself. How am I representing practice? And then that sort of external validity evidence to look to say, and how does this potentially interact, intersect, or conflict with other professions that we may be working with, or that we may be seeking to expand our scope in order to potentially compete with at some point in time.
I think that's a
Okay.
great idea. I think it shows respect for those related professions. Say, hey, we want to make sure that we're respecting your boundaries, but at the same time, hopefully having them build their respect for your profession by saying, wow, that this is what within their scope, look what they're uniquely trained to do, what value they add to kind of this broader team, and really that understanding of it.
I think we as in that kind of like prep discussion is the Venn diagram, Chad. I think that you brought up is just like, here's your role, here's our role, and here's where we kind of overlap. Kind of what were your thoughts on that?
Yeah, that's a great point. In working with groups, I do like using. I'm terrible at producing them, right? Because at psychometrician, we're usually good with numbers. Uh, but the visualization about thinking about your profession as a Venn diagram, and if your profession truly exists in kind of like this silo that doesn't interact with anybody, you wonder how long those sorts of professions will exist, because everybody is interacting in some way, shape, or form with other professions. And so thinking about what are those sort of kind of professions that are close. And Francis, you've mentioned athletic trainers, physical therapy, as two of the primary ones. And I'm sure there's others, in terms of physicians or maybe even like chiropractors or something. I'm not sure, but thinking about how much overlap does your profession have, and so that the inner, like, right, that intersection of the Venn diagram, how much is it overlapping, how much of it is unique, and so that those overlapping pieces become the opportunity for collaboration, and those sorts of handoffs that you were talking about earlier. Whereas the unique aspect is where you add that sort of incremental value beyond what other professions are actually adding. And it's um, sometimes this is something I know that Thomas and Susan and I have all probably dealt with, but when you're dealing with like a group with a job analysis and they're saying like, oh, well, they have to know cardiovascular system, like if you're dealing with a healthcare group. Okay, well, like, what do you need to know about the cardiovascular system, right? So it's not just the topic or the content, but it's at what level of depth and what types of tasks or skills is somebody engaged with in the cardiovascular system. So I'm not going to ask the average person to do an open heart surgery, but I may expect them to know, if somebody's having like a rapid heartbeat or an irregular heartbeat. So that sort of kind of clarification, the depth of knowledge or the level of cognitive complexity goes along with the content itself in helping to kind of more clearly differentiate how your profession is unique from others.
And that seems to me is just like, gosh, and I'm just, it's making my mind go like a million miles an hour because there's so many opportunities here. Is just being able to go, well, where did you learn that from, and where did you practice that? And so where you start tying in things like, I guess from the professionalism side is programmatic accreditation. So if I'm going through a structured program at a university, where did you learn those kinds of those knowledge domains, and then where did you were able to practice it in person? And then in a safe and a controlled environment. So as we're kind of like looking at like, gosh, we're complementary to each other, where I learned it here in school, similar to the way you did it as in nursing school or physical therapy school. I got to practice it using through internships or through kind of like laboratory things or in person while I'm practicing it. I think there's an ability to kind of demonstrate like, gosh, you have certainly your wonderful level of role here. I've done this similar type of training, and here I am, and this is how we can work together and be able to be, what as you were saying at the top, is just like patient-centered care or client-centered care. So that was awesome. Any other thoughts on Chad's comments? Okay. So kind of wrapping up like the last 6 minutes before we jump into kind of the open questions and answers. I guess it's like, could you explore a little bit as a psychometrician? And you're trying to explain this. I think about it in a test development meeting, and you're explaining it to a series of subject matter experts. Not everyone's got to enjoy that discussion, but I'd love to be able to hear your thoughts and how you would explain it. Is when we think about scope of practice and getting up to your bounds, how would you explain it to subject matter experts is when a professional should recognize when they're approaching or overstepping their ability as a certified professional? How would you even explain that?
So I can kick this off. I think that one way that I often try to communicate with subject matter experts about the appropriateness of an examination topic or item is to go back to the eligibility requirements and kind of explain it in those terms. It's like, is this an appropriate topic for someone coming out of school with these sorts of this level of exercise, science courses they have to take, these courses that they take, and an 80-hour internship, or is this really outside of those boundaries? And I think that putting things in context of the minimally competent practitioner who we expect to actually sit for the exam can really help with the scope of practice, because otherwise you can end up Chad was mentioning cardiovascular questions. You can end up with things that are way kind of beyond the boundaries in terms of specificity that we're expecting for that minimally competent practitioner. So I think scope of practice really does have a close relationship with the eligibility requirements for the certification.
And I think extending on that, in a way, it is what Thomas was saying reinforces my belief in the value of creating scopes of practice for professions, because I do like what Thomas was saying in terms of using the eligibility criteria as like a reference point for thinking about where that target is. I literally just did a workshop earlier this morning where we spent 1 hour just on that topic. Like, who's your target audience? What's that appropriate level? And yet we do also know that from kind of both ends of the political spectrum, there is a push to reduce barriers to entry and to reduce regulation by removing some of what we might see as common eligibility criteria. And so if all of a sudden you have a number of people with more, let's say, open-ended eligibility policies coming to your profession, I think it is more incumbent then on the profession to absolutely think about, well, what is our scope of practice? What are those limits? Because now we may not be able to make the assumption that people are coming to the table with more consistent or at least equivalent eligibility characteristics. And so this sort of balance of maybe a formal training program plus experience, it doesn't go out the door because you can still define some of that, but there may be more variability in what you're seeing than what you've seen in the past as some of those barriers break down.
Yeah, and I think where we often see the greatest risk is probably like with maybe what we call scope creep. It's not necessarily that professionals say, oh, now I'm going to go do this today. It's that maybe they're working with an individual or a group and they're working within probably their commonly accepted scope of practice. And then they get asked about these related topics, like we mentioned, nutrition, mental health, something like that. And they start to think, well, I've been reading up on this, or, oh, I've talked to a few other groups about this. So let me, and they just start to creep into that area. And so it's not necessarily an intentional thing, but it can happen. And it could have notable consequences if it becomes more of a widespread issue. So one time what I asked a group was like, well, what, if this person wasn't working with you as this professional and they needed help in this area, would they come to someone like you or would they go to someone else? It's like if they didn't really have, know you and weren't already engaging with you, it's like, would they go find a blank profession? And it's like, well, they might go over there. Then maybe we leave that over there. We define that point, like Thomas said earlier, like refer out and then, but really let that live in that area.
Awesome. I'm going to take a pause just for a second, but certainly to the audience, make sure you ask your questions. If this is your burning questions you have on scopes of practice, licensure, certifications, etc. Make sure you ask them in the Q&A section, and we'll answer those at the end, just as a quick plug. I guess it's like so when we think about, oh gosh, it was on the top of my head, and now it's now kind of into the ether. Is there anything in addition that when we're thinking about kind of like these kind of the voluntary certifications and anything else that you'd like to share that maybe that there's either misconceptions about certifications and kind of what your thoughts are as a psychometrician.
Well, I will say something that certifications are ultimately to protect the public. And that's kind of why we have the minimal standards. The scope of practice also protects the public by making sure that, you know, we're not having people in the credential expected to do things that's not inside of it. So I think that that's just a really important point. It also protects the organization. Just by clearly delineating what falls in and outside the scope of practice.
I remember my question now. So the question I had is just like, and I think about like organizations that have voluntary certifications and where multiple organizations have the same certification or job role. In my mind, the example would be, say, a personal trainer. So you have, gosh, I don't remember how many, the last time I checked the NCCA, there's in the double digits of organizations that offer personal training certifications. But when you do a crosswalk of the documents of the job task analysis, because they're psychometrically developed, often there's substantial or the super majority of the content has overlap. I think the last time we did this for the International Confederate, IC Reps International Coalition for the Registered Exercise Professionals, there was about 96 to 97% overlap between content domain areas. And so maybe that's an opportunity, and kind of maybe if you had some thoughts on it, it's just like, could there just be, you have common consensus among these certification organizations that have personal training, could you have a single scope of practice document for, say, personal training? Or underwater basket weaving for that matter? It's just like if everybody has that same sort of common idea of like, this is what they do, here's the common kind of areas of where they practice, here are the limitations. I guess would that be valuable?
I believe so. And I'm seeing Susan nodding her head too. So there's a parallel example. So a few years ago, Health and Human Services at the federal level in the U.S. did a job analysis related to alcohol and drug counseling, and that the results of that, it wasn't a scope of practice. It was just a job analysis, so it didn't kind of define some of the limits of scope. But it was basically then used as a shared document that any organization, agency who wanted to then develop a certification based on that, there was a common document, a common set of tools that was more kind of profession representative. Because what happens with the job analyses sometimes, and particularly the way that the NCCA kind of currently interprets it, because Francis, frankly, the sort of meta-analytic approach of looking across a number of organizations, to me, is much more stable than what comes out of any one organization, because you have people who are wedded to the philosophy of that particular organization and there may be things missing, or at least differential weighting associated with what is emphasized over other pieces when you go to different groups. And so something that is a sort of shared document that is that everybody kind of has input and support to create, then becomes that sort of, as Thomas was saying, like if you're going to do this every 5 years, 7 years, that you have something that is more robust and there is less variation than on the interpretation of that, which then really starts to suggest, hey, this is a profession, there's consistency, and what I do in Nevada versus Nebraska versus North Carolina may vary a little bit based on the population of clients that I'm working with, but that the core scope of what it means to be credentialed or certified in it doesn't change regardless of practice setting.
Wonderful.
I agree. I think
All
it's
right,
more likely to be respected from the outside and from everyone involved, all your stakeholders, if there's an ability to come work together and come to consensus on it.
Wonderful. So we have two questions that came in. that is kind of posed to all three of you. So I guess the first one we wanted to, the first question that came in, aren't states less apt to create licensures because of the costs associated with it? So I think that was the first question, kind of open up to everybody.
I would say yes. It is expensive and time consuming for states. They have to establish a regulatory board, potentially if that's the term they use, the Practice Act. They have to, there's a lot of time, expensive money to kind of go through this. So that's the reason why so many professions are not regulated through licensure, because they effectively have said that profession is doing a sufficient job regulating themselves. As Chad described, it might take a huge incident or a series of incidents for regulatory authorities or even the public to ask those regulatory authorities, hey, we need help here. We need you to step in because this is causing a risk.
Yeah, that's one thing that I heard. I think Chad, you were describing it too. Is just like for both Republicans and the Democrats, it's just like in the backdrop of kind of the military and the military spouses and their families, it's just like being able to go from one state to another. It's very complicated for the end user, and those costs end up getting passed back to the consumer. And when they're thinking about the balance of risk of certification and licensure, just like, is it worth that cost? And I think that's what we've seen, at least from the fitness side. And I don't know, Chad, if you want to add to that or correct me.
Yeah, and that's the current political environment is exactly, Francis, as you've described. There is this interesting convergence of an effort to reduce barriers for different reasons, right? I mean, from the political right, it's we want to reduce government interference in commerce and opportunity. On the left, we want to reduce barriers to opportunity for individuals who may not have had similar educational or workforce opportunities. So it's one of those rare instances where politicians can agree, even if it's not for the same reason. And then libertarians are in the middle saying, like, let's remove all barriers for everything. And so I definitely think that though some states, and I should say jurisdictions, I always leave out DC and Puerto Rico and the Virgin Islands and such, but some jurisdictions are more or less, and including Canada, right? Even certain provinces are more or less willing to provide more regulatory authority oversight. And so, for example, plumbers, right? Sounds innocuous. They are licensed in a number of states. They are not licensed in a number of states. And then a state like Texas, about 3 or 4 years ago, decided that they were going to sunset that licensure requirement. So they had thousands of licensed plumbers who then it became unlicensed, sort of deregulated profession. So even with the sort of hesitancy to jump to licensure for states, there are certain states that are more willing to provide regulation. I mean, Francis, I think you're from California originally, and
Yep.
as a result, like one of the ones in California, there's a license in California for floriculture, which I've always been fascinated by because I'm like, is a flower going to kill me or something? But I guess if I eat the wrong flower, maybe it will. But that is a licensed profession in California. I am not aware of other states where that is a license. So there is some variation still by jurisdiction.
I guess it's like I do want to ask, and before we run out of time, is how are like licensing bodies that are now going after multi-state compacts going to affect that? Because I know I've heard that with a couple of in a couple of professions where they're going. I guess could you explore is what is a multi-state compact, and does it change things?
Yeah, so the multi-state compact is essentially an extension of government trying to reduce barriers to those sort of reciprocal agreements, Francis, that you mentioned. So a nurse who is licensed in South Dakota should be able to go to Utah, Wyoming, Nebraska, Kansas. They should be able to have some sort of freedom of movement without having to go through the sort of licensing process within each of those jurisdictions separately for some of those costing reasons that you mentioned. Even if there are sort of, maybe jurisprudence add-on requirements there. The compact so that's sort of the positive benefit is it for the licensee or the certified person. They may have more freedom of movement across different jurisdictions. The downside risk is that if you're working, it works great if you have essentially a monopoly for the testing organization that provides that information. But when you're in a competitive space, what ends up happening with compacts is organizations will rush to get accepted in a particular state that is a member of a compact, because then instantly individuals are recognized through reciprocity in those other states. So what happens is among the compact, for competitive certifications or even licensing exams, it is the lowest common denominator, meaning whoever has kind of the lowest acceptable examination is the one that then people will rush to in those states in order to then be eligible anywhere in the compact. We saw this among some bar examinations where there was some reciprocity because different jurisdictions had different passing scores. So you had an increase in test takers in certain jurisdictions that had lower pass rates with no intention of ever practicing there. They just wanted the lower passing score opportunity to be able to move to a jurisdiction that then would have to basically grant reciprocity because they were admitted to bar in the other state.
Right. The other question that we had that came in as well is, could any of the three of you distinguish the difference between a certification and a certificate program? And I'm thinking they're meaning like an educational certificate program as defined by NCCA.
Well, I mean, ICE distinguishes, it's sort of the nature of the relationship of the education. So an assessment-based certificate is one where there is an intended alignment among curriculum or training measurement objectives, along with instruction, and then ultimately sort of almost like an end of course assessment that you would take for that. And the certificate is intended to be very time limited. There is no continuing education or maintenance requirements. Whereas certification, again, as defined by ICE, because Webster's and the broader industry does not define it this way, but ICE defines it as a process by which there are eligibility, some sort of demonstration of competence, and then a maintenance of competence requirement, so that it really is intended to be almost like a continuous improvement for the individual. Thomas, you've written about this too. Do you want to add to that?
Yeah, I mean, in a general sense, a certificate is more narrow. It usually covers a specific set of skills, maybe a subset of a knowledge area that would be in a certification. Certification is generally a more broad application for kind of all the tasks and knowledges that you're going to be doing in your particular job role.
So the last question, because I know in the last 2 minutes, and maybe we can use this as your kind of like your parting thoughts. And it's kind of a complex question, but to see if you can kind of distill down what your thoughts are in maybe 1 or 2 sentences. In developing a scope of practice, how much does the minimum competence or JTA play a role versus the input of other professionals and stakeholders? How can we as exercise professionals navigate the advocacy of our own scope compared to the perceived overlap with other professions? That's a very deep question, but I'd love to have, and we have about 2 minutes to answer that.
Okay, I'll start with the first part. Maybe one of my colleagues wants to jump in more specifically on the second part. So in developing a scope of practice, we don't want to get into the specifics necessarily of JTA and minimum competence. We are talking about scope of practice for someone with this credentialed in this way. And so we're not going to say, well, in the first year, the scope says they could do this, but within 5 years and then 10 years. What we want to make sure we set the bounds on is what they are qualified to do based on those eligibility and qualification requirements we've set out. And then what they're not qualified, in those bounds, again, what maybe is outside their purview, that they would require additional specialized knowledge, skills, and training and likely there might be a different credential to provide those services. And so that's where we want to define, but we have to recognize that this scope of practice would govern kind of anyone in this profession, just leaning on this particular credential versus time-bound, entry-level, minimally qualified. The JTA would get into more of those specifics there and decide what knowledge and skills they specifically have to demonstrate at that time.
Great. We're at the top of the hour, but I don't know if it's anybody wanted to answer the last final thought and kind of go from there. And then we're going to end after that.
Oh, sorry, Thomas, I'm gonna jump ahead of you really quick. Very quickly, Francis, what I would say is, and segueing to the graphic that you have behind you there with the person tying their shoes, presumably on a track somewhere, that a big part of scope of practice is saying, your career is a marathon, and on a track, if I'm running a race on a track, I have to generally stay in my lane, right? The longer races, we know, there's the analogy holds, but for that marathon, define what that lane looks like and how can you stay within that lane throughout that sort of course of your career in ways that you may bump up against it, but that you don't cross over and start to put risk to the profession or yourself as a professional.
Thomas, last 10 seconds.
Oh, I will say that the JTA can be a bit of a basis for the scope of practice if there are issues with overlap with other professionals. If your JTA doesn't have, creating dietary plans in it, and it just has understanding nutritional knowledge. So really the scope of practice, a lot of it can be about kind of the distinction between those points and kind of your level of knowledge in each area and how much that's specified.
Wonderful. I know we ran about 2 minutes over, but I know this is I love this topic and I love nerding out with the three of you. Thank you so much for joining today's call. This call is recorded and it'll be posted to the US Reps YouTube page. And it's gonna be free for you all to review at your leisure. Thank you all for joining today, and thanks to our esteemed panelists. Thank you again. Take care.
Thank you.
Thanks so.
Thank you.